You fall, you get up. You think you're fine. But inside your body, something has already started. A hidden process that could send a clot racing to your lungs and turn a lucky escape into a medical emergency. By the end of this episode, you'll know why 1 in 4 seniors develop deadly clots after a harmless fall, and what to do in the first 72 hours to save your own life. The warning signs aren't what you think. And the most dangerous advice? Just rest and wait it out. Dr. Harper, I have to admit, until last year, I was one of those people who thought, if I can still walk, I must be okay. My neighbor Martha slipped in her kitchen, landed hard, and everyone said she was lucky, just a bruise. But 3 weeks later, she was rushed to the ER with shortness of breath and passed away from something I'd never heard of, a pulmonary embolism. I still wonder, could anyone have seen it coming?
Susan, you're not alone. I hear stories like Martha's almost every month. It's the harmless falls that haunt me the most, because they often trigger something deep and unseen. When you fall, your veins, especially in your legs, can get injured. Even if you're not bleeding on the outside, small tears or even just the lack of movement can set off your body's natural clotting system. It's supposed to protect you, but in seniors, that same system can backfire. The result? A deep vein thrombosis, or DVT, quietly building. And here's the kicker. According to a 2024 review in the Journal of Thrombosis and Hemostasis, up to 25% of seniors hospitalized for falls later develop DVT or even a full-blown pulmonary embolism, often without any broken bones or dramatic injuries. The real killer is silence, because you rarely see it coming.
That statistic honestly scares me. 1 in 4? Dr. Harper, what actually happens in the body after a fall that makes this so common for seniors?
Let's paint a picture. Imagine your veins as soft, flexible highways carrying blood from your legs back to your heart. When you fall, even if you don't break anything, you can bruise those veins or cause small internal injuries. Your body responds by sending clotting factors to the area, sort of like sending road workers to patch up a pothole. But in seniors, the balance is off because we move less, have more fragile blood vessels, and, let's be honest, sometimes avoid getting up and walking after a fall. Those clotting factors can kind of overreact. Instead of just patching a tiny hole, they start laying down a traffic jam of clots. That's how a DVT forms. If that clot breaks loose and travels to your lungs, it can block blood flow and become fatal within minutes. Here's something else. Harvard's Brigham and Women's Hospital published a study in 2023 showing that seniors who stay immobile for just 24 hours after a fall double their risk of developing DVT. So it's not just the fall, but what happens next.
So what are the warning signs? Martha, my neighbor, just had a sore leg and thought it was from the bruise.
Exactly. That's the trap. Most people think if I had a clot, I'd know it. But the first symptoms can be subtle. Swelling in one leg, a crampy feeling, warmth, or just a strange tenderness. Many seniors blame it on arthritis, a pulled muscle, or, like Martha, a simple bruise. But here's a chilling truth. A 2022 meta-analysis in The Lancet found that over 40% of DVT cases in seniors are missed on first contact with doctors, simply because nobody suspects a blood clot after a minor fall. And by the time chest pain or shortness of breath shows up, the clot may have already reached the lungs.
That's terrifying, honestly. I can't tell you how many friends I've seen say, I'll just rest for a few days. I've done it myself, but you're saying that could actually be the most dangerous thing to do?
That's right. Just rest is often exactly the wrong advice, unless your doctor specifically tells you to stay off your feet due to a break or severe injury. In fact, Johns Hopkins released a study last year showing seniors who get up and gently move As tolerated, of course, in the first 24 to 48 hours after a fall, lower their risk of DVT by nearly 50%. Of course, always check for fractures first, but the instinct to just wait it out and lie on the couch can actually set you up for real danger. Let me share a real story. One of my patients, Mr. Perkins, fell while reaching for a book. He felt embarrassed more than anything, told his wife he'd be fine. For 3 days, he barely moved, thinking he'd rested off. On day 4, his left calf swelled and felt hot. He chucked it up to the fall. By day 6, he could hardly breathe. By the time they reached the ER, it was almost too late. A massive pulmonary embolism had blocked blood flow to his lungs. He survived, but just barely.
I can hear how close that was in your voice. And Dr. Harper, I have to say, this episode already has me thinking about every little ache I've ignored. How do you know when it's time to get checked out? What's the red flag that says, don't wait?
Great question, Susan. If you notice any swelling, warmth, tenderness, or unexplained pain in one leg, especially if you've had a fall in the last few weeks, don't wait. Call your doctor or go to urgent care. And if you suddenly have shortness of breath, chest pain, or feel lightheaded, call 911. Those are signs a clot may have moved to your lungs. But here's something almost nobody tells seniors. You can actually do a simple, gentle, at-home DVT self-check right after a fall. Of course, it's not perfect and never replaces a doctor, but knowing what to look for is empowering.
Wait, a self-check? What is it, and is it safe?
Absolutely, and I want every listener to remember this. Here's how it goes. First, compare your legs. Are they the same size, or does one look or feel more swollen than the other? Gently touch both calves. Is one warmer or tender? Try to flex your ankle upward. If you feel sharp pain or the swelling is new since your fall, that's a sign to call your doctor immediately. Of course, this doesn't replace medical advice, but according to a 2022 British Medical Journal guide, early self-detection combined with prompt reporting to a doctor can reduce complications by up to 60%.
That's so specific, and I love that it's something people can actually do. But Dr. Harper, what about people who are scared to bother their doctor or feel like they're being paranoid? My own mom, rest her soul, hated going to the clinic. She always thought the doctor would just say, "You're fine, just old age."
Susan, that's such an important point. Many seniors, especially those who grew up in the don't complain generation, feel guilty for speaking up. But here's the thing, DVT and blood clots don't care about manners. In fact, the American Heart Association published a 2023 study showing that seniors who advocate for themselves, even if it feels awkward, have better outcomes and lower rates of undiagnosed DVT. And if you're worried about the doctor brushing you off, try this script. "Doctor, I had a fall and now I have swelling and pain in my leg that's new. Could this be a blood clot? Can we rule that out?" This puts the possibility on the radar and makes it much harder for anyone to ignore. But there's more. Later in the episode, I'll share a recent study that changed how we treat post-fall patients and the 3-step prevention plan every senior should know. There's a breakthrough that most people haven't heard about yet.
Now I'm really curious. Before we get to that, Dr. Harper, let me ask, what about medications? Are there any common drugs that make DVT more likely after a fall?
Excellent question, and yes, there are. Certain medications like hormone therapy, some blood pressure pills, and even common painkillers can increase clotting risk, especially when combined with immobility. A 2023 analysis in Circulation highlighted that seniors on multiple medications have up to a 30% higher risk of clot formation after a fall. That's why your medication list matters so much. But don't worry, Susan. In just a moment, I want to break down exactly what to ask your pharmacist and how to spot drug interactions that could quietly raise your DVT risk. Because prevention starts with awareness. And one surprising over-the-counter medicine is on almost every nightstand. But the story doesn't end there.
Dr. Harper, you just made my ears perk up. You said there's an over-the-counter medicine sitting on almost every nightstand that could quietly raise DVT risk after a fall. I'm sure half our listeners are wondering if it's sitting in their cabinet right now. What is it?
It's so common that I almost guarantee it's in every home. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen. Most people take these for pain after a fall, thinking it'll help them heal, but here's the kicker. A 2023 study from the Cleveland Clinic found that seniors who took NSAIDs daily after a fall were 26% more likely to develop deep vein thrombosis compared to those who used safer alternatives or avoided them altogether. NSAIDs can actually affect how your blood clots and, ironically, sometimes increase the risk of clotting in people with certain risk factors, especially if you're immobilized. Of course, they have their place. Always talk with your doctor, but relying on them to tough it out, the pain, and stay still is a hidden trap. And that's not the only medication story most seniors don't hear.
That's shocking. So what should someone do instead if they've had a fall, are in pain, and worried about clots? I know people who are afraid of stronger pain meds and some who don't want to take anything at all.
The real answer is balance. If you're in pain after a fall, the safest plan is to check in with your doctor and ask for options that won't increase your clotting risk. Acetaminophen is often safer, but again, everybody's different. And here's something you can do. Bring a full list of all your medications to every doctor visit. There's research published in JAMA Internal Medicine 2023 showing that seniors who keep an updated med list and review it with their provider after any fall cut their risk of dangerous drug interactions in half.
I have to admit, sometimes I forget all the names and dosages. What's the easiest way to keep track? Is there a system you recommend?
Absolutely. There's an easy fix. Use a simple notebook or even just take photos of your medication bottles with your phone. The American Geriatric Society found in 2022 that even that tiny step, showing your provider a picture, reduces prescription mistakes and missed warnings. There are even free apps now, but even old-fashioned pen and paper is better than relying on memory. And let's be real, Susan, it's easy to feel overwhelmed by pills and bottles. But the key isn't being perfect, it's being proactive, especially after a fall.
I love that. And honestly, I think it helps listeners feel a little more in control. Dr. Harper, you mentioned earlier that you had a new 3-step prevention plan you're sharing with patients. Can we talk about that? Because, as you know, after a fall, most of us are just worried about getting back to normal.
Absolutely, and I'm glad you brought us here. After years of seeing too many minor falls turn deadly, I started using a simple 3-step checklist with my patients. The latest research backs it up, too. Here's how it goes. Step 1. Move early, move safely. Unless your doctor says otherwise, try to get up and move, even just to the bathroom and back, within the first 24 to 48 hours after a fall. Don't push through pain, move gently and gradually. A 2023 British Geriatric Society study showed that early, safe movement cut DVT rates in half for seniors who didn't have fractures. Step 2. Hydrate and elevate. Keep your legs elevated above your heart when sitting or lying down, and drink plenty of water. Dehydration thickens blood and raises clot risk. A new study from the Mayo Clinic found that proper hydration alone lowered DVT risk in post-fall seniors by 33%. Step 3. Know and check the signs. Do the self-check I mentioned earlier. If you notice swelling, warmth, or tenderness in one leg, don't ignore it. Call your doctor. And be extra alert for shortness of breath, chest pain, or feeling faint. Those are emergencies. But here's the twist. Most people forget to repeat the self-check for several weeks after a fall, thinking the danger passes quickly. But DVT can develop days, even weeks later. So schedule a weekly leg check-in with yourself. Put it on your calendar. The Thrombosis Research Institute recommends monitoring for up to 30 days post-fall.
I love the leg check-in idea. That's doable. It's not overwhelming, and it's so specific. Dr. Harper, you mentioned something earlier that I want to circle back to. You said there's a new breakthrough in how doctors are treating patients after a fall, something that could change everything.
Yes, and it's shaking up old habits. For years, the standard advice was rest up. But now, based on a 2024 New England Journal of Medicine review, hospitals across the country are starting post-fall DVT protocols. These protocols include early mobility, hydration, routine clot screening, and in higher risk cases, preventative low-dose blood thinners. Seniors who go through these protocols have 38% fewer fatal blood clots after a fall, and more hospitals are adopting them every year. But here's the bad news. Many primary care clinics and senior living homes still don't know about these protocols. So sometimes you have to ask for them by name. Can I be screened for DVT? Is there a post-fall prevention protocol? That little question could save your life.
This is such a hidden world, Dr. Harper. I mean, I never would have guessed any of this after a little tumble. I keep thinking about my neighbor Martha, if only she'd known to ask. For someone listening, who's scared, who maybe just fell last week, what do you say to them right now?
First, you're not alone, and you don't need to be afraid, but you do need to be proactive. If you recently had a fall, even if you feel okay, do a self-check. If you have any red flag symptoms, call your doctor today. It's not about being dramatic, it's about catching a silent threat before it becomes a crisis. And if you're worried your doctor won't listen, bring a family member or friend to advocate with you. A 2023 National Institutes of Health study found that seniors who had a medical advocate with them during appointments were twice as likely to get a thorough evaluation and necessary scans.
That is such a powerful tip, and honestly, it makes me feel better too. Sometimes I still feel that old fear, like I'm being a bother, but you're telling me that speaking up isn't just my right, it could save my life.
Absolutely. And let me be clear, most doctors want to help, but healthcare is busy and sometimes things slip through the cracks. When you're clear, specific, and persistent, I had a fall, I'm worried about DVT, can we check for it? You make it much less likely anything important is missed. But, Susan, before we move on, I want to share a story that really brings all of this together. A story of a patient who almost lost everything because she didn't speak up, and how one small question changed the outcome. It's a true story, and it has a twist I think everyone needs to hear.
I'm hooked. Tell us what happened.
Her name was Gloria. She was 78, living alone, fiercely independent. She slipped getting out of the tub. Nothing broken, just a bruise. For 2 weeks she rested, thinking she was doing the right thing. But then her daughter, visiting from out of town, noticed her left calf looked swollen. She insisted it was just old age. Her daughter, worried, took a photo and texted it to their family doctor.
That gave me chills, Dr. Harper, and I can imagine so many listeners seeing themselves or their loved ones in Gloria's story. Maybe someone's thinking, that's me right now. For those people, what's your don't wait advice right this minute?
My advice is simple. If you notice new swelling, warmth, or pain in your leg after a fall, don't wait and hope it goes away. Get checked today, not tomorrow. If your doctor says it's nothing and you still feel uneasy, ask for an ultrasound. Push gently but firmly. The earlier you find a DVT, the safer and easier it is to treat. And never underestimate your instincts. If something feels off, speak up. advocate for yourself, or have someone advocate with you. You have the right to protect your health. But stay tuned, Susan, because after the break, I want to talk about something almost nobody realizes: how other conditions like cancer, heart failure, or even long-haul travel can quietly raise your DVT risk after a fall, and how seniors can stack the odds in their favor no matter their health history.
Dr. Harper, I can't thank you enough for what you've shared so far. And listeners, don't go anywhere. If you thought DVT risk was just about falls, you're about to learn why your overall health, even things you'd never suspect, could turn a minor slip into a much bigger threat. Dr. Harper is about to open up a whole new chapter. I have to admit, Dr. Harper, you're making me rethink not just falls, but everything that goes on with my health. You said right before the break that there are hidden risk factors, things like cancer, heart failure, or even travel that can quietly stack the odds against us, even after a minor fall. Can you open that up for us? How do these other issues play in?
This is the part that surprises almost everyone, Susan. DVT isn't just about falls. Think of it as a perfect storm where different health factors quietly pile up until the risk tips over. For example, a 2023 study in the Lancet Hematology showed that seniors with cancer, even those in remission, are nearly twice as likely to develop DVT after an injury, simply because cancer changes how blood clots. It's not just cancer either. Conditions like heart failure, chronic lung disease, or recent surgeries all make blood stickier and slow down circulation. Add a fall, where you may become less mobile for days or weeks, and you've got a recipe for clot formation. Even something as routine as a long car or plane ride can quietly double DVT risk for up to a month, according to Circulation 2022.
So it's really a web of things, not just one bad day, but how everything else in your body is working. I never would have thought a road trip or having surgery a few months ago would change my risks after a fall.
That's exactly it. And here's the hidden trap. Most people think, that was a long time ago, I'm fine now. But new research from the National Institutes of Health in 2024 found that seniors who've had surgery or cancer in the past year, or who are being treated for heart or lung conditions, need to watch for DVT signs for weeks, sometimes months, after any fall or long stretch of immobility. I often tell patients, don't just think about what happened yesterday, think about what's happened in your body this year. Your total risk is a combination of history, health, and what you do right now.
So for someone listening who has any of these risks, cancer, heart disease, even just a history of being less active, does that mean they're doomed, or is there still something real they can do to tip the odds back?
That's the best part. There's always something you can do, and it doesn't have to be dramatic. Take the idea of stacking your odds. It's not about being perfect, it's about small, steady steps. For instance, a 2024 multi-center trial in JAMA Cardiology found that seniors who combined gentle daily movement, hydration, and routine leg self-checks cut their DVT risk by over 40%, even if they had multiple medical conditions. Here's another secret weapon, Susan: compression socks. They're not glamorous, but in a randomized trial from the British Medical Journal last year, seniors who wore medical-grade compression stockings after a fall or hospital stay had significantly lower rates of clots, especially when combined with regular walking, even inside the house.
You know, I always thought compression socks were just for plane rides or people with varicose veins. I had no idea they could help after a fall.
Absolutely, and you don't have to wait for your next flight. If your doctor says it's safe, putting on compression socks in the morning, especially if you're less active or recovering from a fall, can keep blood moving, prevent pooling, and stop clots from forming. And here's a tip for our listeners: not all compression is created equal. Look for medical grade, usually 15 to 20 millimeters of mercury, and ask your doctor for a recommendation, especially if you have circulation issues. But let's not forget the emotional side, Susan. Falls can really shake a person's confidence. Sometimes the biggest risk isn't just the physical injury, it's the fear that creeps in afterwards, making people afraid to move, go outside, or even leave their bedroom. That can be just as dangerous, because the less you move, the higher your risk for DVT and a host of other problems.
I feel that so deeply, Dr. Harper. After I took a spill a few years ago, it changed how I walked. For weeks, I was scared to even get the mail. How do you help people break out of that cycle of fear? Because it can feel paralyzing, like you're always one step away from disaster.
It's such an important topic, and you're not alone. In fact, a 2023 Yale School of Medicine study showed that nearly 60% of seniors report ongoing fear of falling after a single incident. And here's the twist. Those who avoid activity actually become weaker and more prone to another fall or to DVT. What helps most is support, physical and emotional. I encourage my patients to work with a physical therapist or join a local fall prevention class. These programs don't just teach balance, they help you regain confidence, rebuild strength, and prove to yourself that you can move safely. Research from the Gerontologist 2024 found that group-based fall prevention reduced repeat falls and clot-related hospitalizations by 30% over 1 year.
That makes me think of my friend Leela. She joined a class at the senior center and swears it changed her life. She used to be terrified after breaking her wrist, but now says she's more herself than ever. So maybe there's hope even if you're starting out scared.
Absolutely, Susan. Recovery isn't just about the body, it's about the mind and spirit. And it's never too late to start. Even if you've been less active for months or years, every bit of movement, every bit of connection stacks the odds back in your favor. Before we wrap up, there's one more twist I want listeners to hear, something that often gets missed in routine appointments. Many seniors think, my doctor will catch anything serious. But with how busy clinics are, DVT and post-fall risks can slip through the cracks unless you bring them up. Here's my golden question for every checkup. Given my age and my recent fall, am I at risk for blood clots? Is there anything we should check or monitor? That question alone, according to a 2023 Kaiser Permanente study, triples the chances you'll get a proper evaluation.
So, to all our listeners, write that down. Ask the question. You're not just being a bother, you're taking charge. And honestly, Dr. Harper, I wish I'd heard this years ago. For someone listening who's still worried, who's still thinking about their last fall, or maybe even feeling symptoms right now, what's your last, most urgent piece of advice?
Trust yourself. If you know the swelling, warmth, pain in your leg, or sudden shortness of breath, don't wait. Call your doctor or 911. If you're worried about your risk, speak up, even if it feels uncomfortable. And most importantly, don't let fear of falling stop you from moving, connecting, and living. Use what we've talked about. Move gently. Check your legs, hydrate, wear compression socks if advised, and ask the right questions. You have more power over your health than you think.
That's so reassuring. Before we say goodbye, I want to share one last story. My own father had a fall late in life. He was proud, stubborn, hated to complain. It was only because my mother noticed his swollen ankle and made a fuss that the doctors found a clot early. He used to say, "Don't make a mountain out of a molehill." But she did, and it gave us 2 more years with him. So to everyone listening, make the fuss. Ask the question. Take that one extra step for yourself or someone you love.
That's powerful, Susan. And I hope every listener hears your story and feels empowered to do the same. Falls are a part of life, but with the right knowledge and a little courage, we can turn a potentially deadly risk into another story of survival, strength, and connection.
Dr. Harper, thank you for your expertise, your stories, and your heart. And thank you to everyone listening. You are the reason we do this. If you've fallen recently or know someone who has, share this episode, start a conversation. And remember, the smallest sign, the smallest question could make all the difference. Don't miss our next episode where we'll uncover the silent signs of bone loss, what every senior needs to know to stay strong, steady, and independent. Until then, take care of yourself, move with confidence, and never be afraid to ask for help. Your health, your life, your future. It's worth fighting for.